joint is the articulation of where two bones meet. There are several different types of joints that we'll talk about in a little while, but first of all, joints generally serve two functions. Number one, to hold the bones together, obviously, and number two, to allow for mobility or flexibility. Some joints don't really move a whole lot, like the joints between the bones and the skull, but they still allow for some sort of flexibility and cushioning. Joints are classified by both how they function and how they are built structurally. And so the different types of functional classifications are what we call synarthroses, which are immovable joints. That would be like a suture joint in the skull. Amphiarthroses, slightly movable joints, and then diarthroses, freely movable joints like your elbow. Structurally, joints are categorized into fibrous joints that are generally immovable, cartilaginous joints, and synovial joints. Synovial joint would be like your knee. They are fluid-filled. They have a fluid-filled capsule, and they allow for quite a bit of movement. Fibrous joints are bones that are united by fibrous tissue, as we see here, like in the where the sutures in the skull. These are generally not a whole lot of movement in these joints, but they allow for flexibility and cushioning. Then we have the cartilaginous joints that are where bones are connected by cartilage, as we see in the pubic symphysis and in the spaces in between the vertebra. You see the pad of cartilage here separating each of the bones. This allows for cushioning and a little bit of flexibility and range of motion. Then finally, synovial joints. These are articulating bones that are separated by a joint cavity. There is synovial fluid found inside the joint cavity. So this whole joint cavity is kind of sealed off like a capsule, and it has fluid in it which helps to lubricate the joint and allow for better range of motion. In synovial joints, you have the articular cartilage, which covers the ends of the bone. This is also called hyaline cartilage, like we saw in our histology lab earlier this year. And the joint surfaces are enclosed by a fibrous articular capsule. The cavity is filled with synovial fluid, and then there are ligaments that wrap around and reinforce the joint. Within the synovial joint, you have what's called the bursa. You may have heard of people having bursitis, which is inflammation of the bursa. The bursa is a flattened fibrous sac that's lined with synovial membranes and filled with synovial fluid. It's not part of the joint, but it's kind of like it's a padding that's inside of the joint. An example would be the bursa that's behind your kneecap. Then we have the tendon sheath. The tendon sheath is an elongated bursa that wraps around a tendon. It's kind of a protective covering around the end of a tendon. In the diagram here, we see the shoulder joint. And shoulder is one place where you regularly hear about people developing bursitis. And so here's this fluid-filled sac called the bursa. And so in the case of bursitis, this would become inflamed and irritated and cause pain in the joint. You see the hyaline, or the articular cartilage, that's lining the ends of the long bones. Okay, within the category of synovial joints, there are several different subcategories based on the way that the joints move. First of all, you have a plane joint, like we see in the carpals and the tarsals, which allows for kind of a sliding motion in between the joints, a little bit of rotation and a little bit of back and forward sliding motion. Secondly, we have a hinge joint, like we see in our knee and our elbow, in our arm, where the humerus and the ulna articulate, and it allows for a pretty good range of motion with a high degree of stability. This joint, it's going to move in one direction. It doesn't have the freedom of movement that you would find like in a shoulder joint, but it also doesn't have the instability of the shoulder joint. It's pretty uncommon to dislocate your elbow, and very painful if you do so. We also have pivot joints, like where the radius and the ulna meet the humerus. This allows for a rotational movement around an axis, and it allows us to pronate and supinate our hands. That's hold our hands palm up and then flip them palm down. We have condyloid joints, which are like the joints in between the carpals and the phalanges. These allow for a little bit of a there's a pretty good amount of range of motion in that joint. It allows us to grab objects with our hands and move our hands pretty freely. Then in between the metacarpals and carpals, we have what we call a saddle joint. And you can see in the diagram here how these bones kind of lock together. It's very similar to the condyloid joint, only it's a little more stable. And finally, we have a ball and socket joint, like we have in the shoulder, in our shoulder joint between the humerus and the scapula, and in the joints where our hip meets our pelvic girdle. There's a high degree of high range of motion here, but it's also fairly unstable. This ball is just resting on a slight divot in the scapula, and so it's really held in place by a network of ligaments, tendons, and muscles that wrap around the ball, and it's fairly easy to dislocate this joint because of that, but it does give a very good range of motion. These are some of the movements that can be obtained by these different types of joints. We have flexion, which is like the bending of the elbow; extension, which is like straightening your arm out; dorsiflexion is like pointing your toes towards the sky; plantar flexion is pointing your toes towards the ground; abduction is moving anything away from the midline of your body, for example, spreading your arms out like wings; and then adduction would be moving your arms back towards the midline of your body. Circumduction would be moving in a circular motion, like if you were to stick your arm out in front of you and then make circles with your hands. The shoulder joint would be circumducting. And then rotation, and rotation, obviously as the name implies, is sort of a movement around an axis, which allows us to supinate and pronate. Supination is like the hand, whenever you hold your hand palm up, that's in the supine position, you are supinating your palm. And then whenever you rotate your hand to where your palm is facing the ground, that's pronation. Inversion and eversion, if you are standing up and you rotate, you twist your foot so that the sole of your foot is turned towards the midline of your body, that's inversion. And then if you twist your foot outwards so that the palm is rotated, the sole of your foot is rotated towards away from the midline of your body, that's called eversion. Protraction and retraction is what we see like in the cervical, the joints in between the cervical vertebra. It allows us to sort of shift our head forward and pull our head back in a sliding motion. Okay, let's look at some different conditions that are associated with joints. Problems, I've already mentioned bursitis. It's the inflammation of the bursa. It's usually caused by an impact type injury or friction and overuse. We have tendonitis, which is the inflammation of tendon sheaths; arthritis, which is the inflammation or degeneration of joints. This prefix arth means joint, and then itis again means inflammation, so inflammation of the joints. There are lots of different types of arthritis, a couple of which we'll mention here in a second. Osteoarthritis is inflammation of the joint, basically due to overuse. You get a deterioration of the bones near the joint. It can be quite painful and cause stiff joints, but it's generally related to aging and overuse from sports or physical labor, that sort of thing. Rheumatoid, on the other hand, is actually a disease condition it's an autoimmune disease, meaning the immune system actually attacks your own joints and causes inflammation. Symptoms of rheumatoid arthritis include bilateral inflammation, whereas in osteoarthritis you may have one elbow that's has arthritis. Well, a sign that it could be rheumatoid arthritis is if you have equal pain in both joints on both sides of the body. That's a sign that it's going to be autoimmune and not caused by overuse or aging. This type of arthritis can be so damaging that it will actually cause joint deformity. There's gouty arthritis, which is inflammation of the joints caused by urate crystals from the blood. This can usually be maintained with diet. Whenever we're born, the skull bones are not fused together. You may have, if you have little brothers or sisters, you may know about the soft spot in a baby's head. Basically, it takes quite a bit of time for those bony plates to fuse together and form the sutures that really make our skulls strong. And that's the end of our discussion on joints.